Today is about the future of workforce support, well-being, and ultimately retention and sustainability. Let me introduce the panel. Thank you very much. Thank you very much to all of you for joining today. A panel of care leaders, you probably recognize most of them. Professor Martin Green, Chief Executive of Care England. I don't think Martin needs an introduction from me. Irene Gray. Irene, thank you so much for being here. Irene has a few decades of experience in health and care. She started as a care of the elderly nurse quite a few years ago, and she went on to become chief nurse in a number of NHS trusts, chief executive of care organizations, and today she's a non-executive director of care organizations and the coach in health and care. She's also a honorary professor of nursing. Irene, I hope I did justice to your
Hold on.
Amanda Scott, Chief Executive of Forest Healthcare, and Raina, Chief Executive of Agincare. They probably don't need much introduction either, but thank you very much for joining us today. I'm Alessandro Alani, I'm a Director of Talent for Care. Our passion is workforce support and well-being, and we're determined to bring innovation to transform workforce support and well-being for years to come. There is no doubt that the pandemic had a devastating impact on the health and care workforce. Without going back to the stats that we're all familiar with, and most of you in the audience will know firsthand, directly what we're talking about here. But we'd like to start the webinar on a more positive note. We fully acknowledge the devastating impact on workforce well-being and mental health of the pandemic. But maybe the pandemic is also an opportunity to really move forward from here and transform workforce support and well-being. So on a positive note, I'd like to ask the panel, what have we learned in the last 2 years that can help to transform staff support and well-being for good as a result of the pandemic? Amanda, do you want to go first?
Sure, thanks Alessandro. So I've occupied health and social care the whole of my adult life really, and the last few decades have been particularly in social care. At every level, with every team member and leader that I came across social care, I saw dedication, stoicism and determination to work through uncharted waters really. Everything that happened was brand new to people. So that immediate recognition that people were going to rally and come together and support each other played out from home to home, from team member to team member, but across the leaders within social care and the Care Leaders Network, the support such as Care England helped us come together in a way that we kind of knew was there in the background, but came to the forefront as a huge support. Personally, I drew on that in very many different ways. But professionally kind of underlined the professionalism of social care and the dedication that sat within it. So that would be fundamental what we saw with people. In relation to the structure of social care, so many times it's been commented. Firstly, people we could see didn't understand what social care was. In totality, so I think the King's Fund made a great write-up and some videos to explain social care to the general public, and that speaks volumes in itself, that even needed to happen, that the same type of video to explain what is the NHS weren't necessary. And that's not a criticism, it's an observation of where we were at the point where, we were very much in the spotlight. But also that the stat structure that I talked about was creaking already, underfunded, under-recognised, under-talked about and underrepresented in many areas and forums. And how do you invite a workforce towards that structure? and encourage people to make a life ambition of belonging to that structure, actually people don't even really understand what it is. So the people and the structure itself, my initial observations were the right people, not enough knowledge about who we are, what we do, and why we're a body to belong to.
Absolutely. And, as you say, pandemic as a turning point in many respects. We can move on from here and we can really learn about workforce support and well-being and make sure that going forward is going to be different. So, and over to the panel really to just share a few more experiences and think through what can we learn from the last 2 years for years to come.
Well, sorry.
You go.
No, well, I was going to say, I think one of the things, and Amanda, you brought this out, was just how incredibly skilled and committed the workforce were. And one of the things that I noticed was how many things that we were always told we couldn't do as a workforce, we suddenly were doing, mainly because, support like primary care was withdrawn at the start of the pandemic. And it was care staff that really stepped up to the mark. And I think that showed us the real clear abilities and skills that the workforce have. I think it also showed their amazing resilience. And, as you said, people were working in the most incredibly challenging and emotionally draining situations. I talked to members of staff who had been in a situation where they had lost 6 of their residents in less than 24 hours. And that really showed how they needed the support, but also showed how much they supported themselves. So I think some of the key messages were about how competent the staff were, how resilient the staff were, how able they were to deal with things as they happened. But we must not forget that that's taken its toll. And so we must build back better, I think, and make sure that the processes and the structures are in place so that they never have to go through anything like this again unsupported.
Yeah. If I may say as well, I think what this last 2 years demonstrated, particularly in the early days, was the chasm between NHS and social care, the understanding of social care, its potential for provision. And, the transfer of people from NHS into social care without the right systems in place and the impact that had. But within the NHS as well, I think, it was a bit like where the going gets tough, the tough get going. And similarly, I know that, people were working 12-hour days and longer. And again, watching people die and supporting them during death without family near them, the same as we were in the social care sector. So I really do think that out of adversity comes opportunity.
Yes.
And I think we now have a real opportunity to draw on some of those lessons. And some of that opportunity has to be driven at a national level by both politicians and others within the sectors. And, when I consider at the beginning of the pandemic, when I was listening every night to the briefings from the Prime Minister and his team about the current situation, it was a whole month, in fact, I think 6 weeks before social care was even mentioned.
Yes.
And even when it was, I think I messaged somebody and said, hallelujah, social care is now being mentioned. And even when it was referenced to low skill, low pay. This workforce is low skilled and low paid, which is absolute nonsense. And so when that is presented from a political level on a national stage to the public in general, the image that causes, but the impact on morale is phenomenal. So we have to start focusing on changing that attitude and that approach, but it can only come from the top. I mean, we can work at it from the bottom, but it has to come from the top as well. Is, how we promote and the impact of negative messages on the staff that are dealing. And, why would people want to stay in the system if they're being called low skilled?
Absolutely.
We know they're not low skilled.
And the pandemic can be a good catalyst for that, can't it?
Totally.
Or it has to be. We need to make it a catalyst for that to happen. Raina, you employ 3,500 people, I think, give or take, across the country, across England, maybe. And you're very focused on looking after your staff. So what can we learn in terms of what works and what doesn't to support staff to recover from the last 2 years?
I mean, I think everything, my fellow colleagues have said is absolutely true. And I think the issue that Amanda kind of touched on, that rallying, I think, what we learned is, social care work is brilliant in a crisis, and this is an acute crisis beyond anything experienced before. And we did see skills emerging, valued, noticed, recognised by the NHS. We saw bonding, I think, across aspects of social care that we hadn't seen before, both within organisations. I saw our support functions and our direct care teams bond and work together in a very different way. We deliver quite a range of services, and people came together to kind of innovate. So, we saw some fantastic things coming out of the sector in innovation, as Martin said, resilience. I think that the communication work, we really all upped our communication game out at, that forefront, that direct care, the forefront. How do we keep people safe as possible? How do we get supplies to them? How do we listen to them? How do we support them? And I think all of those things have really stayed with us and made us pull out. We did quite a big exercise on what positives have there been from COVID, through all this heartache, through all this crisis. What can we learn about how we worked, and what was effective and more effective, and what got a really good response from our workforce during that time? So we've definitely taken those things forward. I mean, for me, on the negative side is I absolutely think we were poised to really make a difference in terms of how social care was perceived and viewed by the public and by those who work in it. And every day that goes by now, we're losing that. It is just slipping back down. And I think in a way, the sad thing is now I think people had a glimpse of what it was like to be respected, to be relied on, to be seen as better status, to be talked about in the same breath as NHS. And now they see that slipping away every day. And in a way, it's worse to have had a glimpse of that and have it taken away than have the years before, where we were constantly fighting for that recognition that Irene talks about, and that political and media messaging, that it's really distressing now to see that slipping back. You've got government ministers talking about low skill, you've got data provided by the sector and the workforce being ignored, you've got, reports from umpteen, very well respected organisations across the country, from not-for-profit and charitable, for government bodies themselves, and it hasn't been embedded and listened to at that level. So the danger is we're here trying to keep that momentum and build on that, let alone the recruitment and retention issue that's hit, kind of nationally. So I think, I'm very confident as a sector and as providers and organisations, we've got new ways of working with our workforce that were prompted by COVID and are better and stronger than before. It's just whether that's enough. Wellbeing, I think the ICS stuff, the integrated care system, we linked in, we drew down both our own welfare schemes, our own mental health, things like mental health first aiders, things like, more workshops. We obviously did a pilot with you, Sandra, and that was great. But I think that really flagged the difficulties in fundamentally changing the way we support and develop our teams when you haven't got time, resources, funding to do that, because it's so well received when you make that time, but it's incredibly difficult not only to offer it, but for the workforce when they're under such pressure to find their time and space to take those opportunities. From integrated care system, their funding, trying to say, like Martin saying, actually, there's funding coming into the integrated care system. We're supposed to be part of the integrated care system. Can you give some to us, please? And draw some down into that way.
Fully acknowledge everything you're saying. Sorry, Amanda, I'll come to you in a second. Just one point on what Raina was saying. Well, 2 points actually. One is acknowledge all the NHS colleagues who are on the webinar, because I think the conversation about joining up health and care is coming from everyone, from all angles, and I think there's strong recognition from the healthcare side, if you want, that we need to join up, that everyone needs to join up. We've got the pleasure of working both on the care and healthcare side, and we see that conversation really coming together. So just acknowledging everyone from the NHS on the webinar. And then another thing, very briefly, in our experience, Amanda, I'll come to you straight away. But what you mentioned, Raina, the ability to invest directly in the workforce to provide support and well-being to the front line directly is something that until a few years ago was difficult, now it's becoming possible. That's what we do, so we're clearly passionate about it. But what we've seen through the pandemic is extraordinary engagement and attendance for any support, well-being, resilience program. So we have attendance between 85 and 95% over 12, 18 weeks for frontline care workers, nurses, really, everyone who's under so much pressure finds the time if you offer them the opportunity, to be supported directly. And I think that's something else that hopefully we're going to learn going forward in terms of what we can do as a result of the pandemic. Amanda, sorry, you were raising your hand.
No, that's fine. I'm glad you saw my hand. I just wanted to pick up on the point that Raina made earlier, actually, because you were absolutely right in terms of the things that we needed to change very quickly. And my experience, and clearly yours as well, was the way people were able to deploy and adapt and move in response and in step with things as they were unfolding in front of our eyes. The other thing that changed very quickly, to your point, was some of the change in regulation that we'd had as a stranglehold. DBS delays, multiple references with the person not being able to join, and we needed and were enabled to make changes and supported to do that. And that was a godsend because suddenly we were able to be responsive to, we devised a role called care associate, which meant that, if people wanted to come and help, we could give them a role, we could give them a title, we could give them support, we could deploy really quickly. None of those people transpire to be in the wrong place doing the wrong thing for the wrong motivation and for the wrong reasons. And yet, for many years, that stranglehold where you'd hear, of the 10 candidates, we've lost 6 because the DBS is delayed. We've needed to let this person go because they haven't had any previous employment and we can't have that on their HR file. We need to have, so let's not go back and just be pushed back into the corner that strangled us in the first place. And I think as leaders, both in the NHS and social care, we have a responsibility to shout loud about that and make sure that we're not just pushed back into the corner. And in terms, again, of, regulatory outcomes, we see the renewal and update of the regulatory standards that are being moved through at the moment. But where we see write-ups saying we acknowledge there's been a pandemic, I do get frustrated because there hasn't been a pandemic. And hold on, there is a pandemic. I'm not a denier, but we're still right in the middle of this, and the future is untold. We don't know what this winter is going to bring, and beyond. So, I think Raina sort of has opened that up in me that, these are things that we can't let, just as you pointed out, Raina, just move back to status quo pre-pandemic.
I think that's a good bridge into retention, isn't it? And recruitment. But let's start from retention. It's obviously, it is the starting point. And there's no doubt that workforce well-being has a major impact on retention. That's pretty obvious, again, without mentioning specific stats. But I think, the question is, what can we do to improve retention through a pandemic and in a post-pandemic world? And then we can think about recruitment as well. But starting from retention, perhaps. I don't know, Irene, do you want to offer an integrated perspective again from?
Yeah, I'm very happy to talk on this one. I was conscious of something that Amanda just said about we need to shout out about these things. 100% agree with that. But as leaders, and I'm talking now NHS and social care, we also have to listen, and we have to hear what people are saying. And I think this feeds into retention because the workforce across the sectors is inevitably quite shaky at the minute. People are tired. Are they going to stay? There's been a massive reduction in the number of people completing training, their nurse training. That there's a large number of people applying but not completing. There are fewer overseas nurses, obviously, for Brexit. But the length of time people are actually staying in the service is quite stark when you think that somebody from overseas will stay an average of 12 years, a European nurse will stay an average of 9 years, an NHS trained nurse will stay an average of 6 years. So there is something not quite right there. So we have to listen. And in fact, only this morning I was reading a HSJ report saying about a major acute trust, which has suddenly gone from outstanding to requires improvement. And the reason for that was staff saying they're not being listened to. They didn't see the leaders on the floor. They weren't engaged. Things were reactionary rather than proactive. And so, I'm probably saying things that everybody else has been saying, but it's very, very stark at the minute. So I think leaders themselves have to look to how are we caring for staff, which is, I know, everything that you promote, Alessandra, but how are we caring for staff? And that's the retention aspect. Mm. And if we can demonstrate that through retention, then surely there will be a knock-on effect to recruitment. People will want to work. And then I think going forward as well is that recognising that caring for elderly, vulnerable people is a specialty. It's a specialty. We have paediatric specialties, we have cardiac, we have ITU, we have all of these specialties. Caring for elderly people is a specialty. And, all those years ago when I trained, and I'm talking now in the very early 70s, care of the elderly was a specialty. And you chose to move into it. And it was an expertise. And I worked with the first professor of geriatric medicine in the country, Professor John Brocklehurst. And, he promoted it widely. But what's happened to that professionalism? What's happened to that professional status of caring for elderly people? And, when I sit here and think that I think it's 1 in 5, might be even more than that, people working in the NHS and across the country at the moment are over the age of 50. And those people we need to retain to enable us to continue to provide the service right across the board. So I think, we've got a lot of thinking to do here about professionalising the care that we give and how we go about doing that, both from the point of view of registration or from a standardised set of skills required that is recognised nationally right across the board.
Can I say something really controversial? I mean, I think we talk about well-being, don't we? We talk about all those things that you're saying, absolutely true, Irene. But at the end of the day, we're sitting here with a system that remains underfunded, remains with poor commissioning and kind of recognition. So sometimes, and I'm sure Amanda feels this way as well, sometimes I feel like I'm just colluding with a really bad system. So I'm telling people how wonderful this vocation is. I'm telling them that I love it. I'm telling them that social care is great. I'm telling them that I'll look after their well-being as best as I can. And I try and be honest, say this is what we can do as an organisation and this is what the sector and the system doesn't allow me to do, that we're lobbying for and we'd love. But ultimately, people are coming in and they are not being paid what they're valued. They are dealing with really, really difficult situations because for home care, for example, they're going out in delivering shorter and shorter visits to people who need more care. But it's not their fault or our fault they're not getting more care, it's because the system doesn't allocate them more care. But, all the other services that are being stripped away are having an impact on what our teams deal with. Our care home teams are dealing with people with higher acuity levels, with more needs, and in the pandemic, really affected, I think, that job satisfaction. I often say in home care, I think over the years we've stripped out the job satisfaction and the joy and the autonomy that these skilled people have about relationships with people who are receiving care, because that's ultimately what care should be about, relationships and building confidence and independence and community. And it's stripped away to this task-based thing. In care homes, I think we've stripped the joy out now with PPE and testing and visiting, all necessary things, but really strip that job satisfaction and that connection, that emotional connection that underpins good social care. It's about people and feelings and, you know, being in people's lives at a really critical time for them and their families. So I think, I feel, you know, we can, I sit on meetings with Acute Trust when people say, I don't, you know, most of my teams in a hospital don't even know who their line manager is. So we're sitting here talking about personal development plans, we're sitting here talking about wellbeing programs, we're sitting here talking about training. But if you can't even get the basics right every day, things are incredibly hard to meaningfully embed in any organisation, because you can say it, you can try and do it. As fast as you're layering on the well-being, the conditions every day for those people coming into work are so poor because they're being overloaded and they're being underpaid and under-recognised. It's just this kind of really, so sorry, that probably sounds negative. I'm not meaning to sound negative, because I think there's a lot of great work, but it goes back to that point about that political agenda, that funding, the structure. And it feels like as providers, as direct providers, where you're really trying to peddle, you're just fighting this kind of, you know, like hamster wheel, where the more that goes wrong, the more you're trying to compensate for that. And it works to some degree, but sometimes it feels a bit hollow.
And in terms of fighting for all of that, I think Martin couldn't be more in the front line. Mm-hmm. So fighting for funding, but also the professionalization and the recognition conversation, Martin, that you're certainly driving.
Yeah, and I think so, right. And Raina, I don't think you were being negative. I think you were being realistic. And I think we should acknowledge where we've got to go from in order to get to where we want to be. I think there's some real issues which have come out in the pandemic about recognition and how people feel valued. And I really think that has to be the cornerstone of how we develop an approach to retaining our workforce. Because often, you know, one of the things that's really interesting is how committed and how values driven a lot of our colleagues are at a time when they're not getting the recognition, they're not getting the salaries. So we've got to really fight that battle. We need so much more money in this system. And if we're going to talk about professionalising the workforce, well, professionalism comes with high salaries, with lots of training, with time for reflection. And of course, the way services are commissioned, it doesn't enable us to do that. And I think that we shouldn't underestimate as well the enormous emotional toll that it takes on somebody when they know they haven't had time to support somebody effectively, and then they have to rush off to the next person and they feel the same way about that. So we've got to get the basics right about the good stuff around values, around respecting the workforce, around professionalising them. But we've also got to accompany it, you're so right, Raina, with some really clear, tangible things, and that requires money. There is no two ways about it. We cannot shy away from the fact that you cannot build a professional workforce without the money to develop the systems and structures and to enable staff to feel valued and to tangibly see they are valued in their pay package.
I'd like to comment there. I couldn't agree more, Martin. And one of the frustrations through the panic in terms of money and grant that was offered were the very different approaches and ways local authorities went about actually allocating that grant money in terms of timing. So, you know, a grant is given in these exceptional times because there are exceptional problems and delays and again, strangled criteria meant, certainly my experience was, I think I have a really good idea how I could spend this best, but it doesn't fit the tram lines that have been placed around me to make it fit. And it would be really interesting to understand how much of that grant money has had to be given back because people couldn't make it fit, as opposed to have they been allowed to use it, make it work. But looking forward, so much at the moment indicates to me cannibalisation of workforce between NHS and social care. So, we're seeing all sorts of extreme approaches for people to quite understandably want to fix their own problem. And it worries me deeply because it's changed the nature of people's focus. A tired workforce, now seeing grant money being spoken of, it hasn't appeared yet, and wondering when that trickles down. And that can lead to people feeling suspicious and concerned about where has it gone and when is it coming and what do we see of it. But putting that aside, because there isn't an immediate solution for me, I think one of the viewpoints in terms of retention and recruitment for me is the inclusion of your workforce. To me, that is absolutely critical. Honesty, inclusion, and ensuring that people are part of the problem-solving approach. What do they say? A vision without a plan is just a dream. So, we can vision forward, but what do we do right now? So what I'm trying to do is make sure that we set the tone of what winter pressures are going to look like. I learned as a nurse when I was training, if you tell a patient what their post-op experience will feel like, they have a better recovery. And I think you can apply that to the workforce. If you tell the workforce and you have honesty with them about what winter might look like, and do as much preparation for that as you can, then there's a potential for better outcomes just because people are more prepared psychologically. Empathy and appreciation go without saying, but making sure that isn't blanket and corporate, but making sure it's bespoke and towards the individual and recognition of the individual above and beyond, as well as across the team. Communicate to me. Share the plan, discuss with people what that plan is, but listen. As Irene said earlier, get the feedback. It's not a shame to say, I thought this would work, it isn't. Let's change back from that. Connect with the team more and look for those resilient leaders and be agile in bringing them in to help others that aren't feeling that resilience at the moment. So I just wanted to throw in there some of those really positive things that in the micro we can think about doing while the macro swirls around us and we try to make some sense of it.
Keeping a positive outlook here. It's about, what can we do? What have we learned? What can we do as a result of the pandemic? And while we're still in a pandemic, excuse me, as you're all saying, and just very briefly from us, and, with some of you, we had the pleasure of doing this together, but, investing direct, and it's difficult because you need to find the money to be able to do it, but investing directly into the front line, into the workforce at all levels seems to have major impact. When you talk about engagement, and everything we do in a pre-pandemic world was about retention, now it's about recovery and retention and well-being, obviously. But, when you measure engagement from people in the front, from everyone in the front line who had the chance to have some investment in their support and well-being, I mean, you see the engagement levels going up immensely. We measure that on all of our programs. And you see 75 to 85% of participants in a support, well-being or recovery program to say at the end, and it's all self-assessed, to say that their sense of belonging in the organization they work for, not just in the sector, but in the organization they work for, has improved or significantly improved. And we ask the question in a different way, in terms of feeling valued as well, and you get the same response. So when we have got the ability to invest directly in the front line, that immediately translates into engagement and feeling valued. Obviously, the question is, how to fund it in a sustainable way. Now, I really want to go to open up the Q&A as quickly as possible. Perhaps just one thing. So we said, let's go back to the webinar title for a second. There's no going back. The pandemic has changed, is a catalyst for changing workforce support and well-being. We need to make the most of it. So let's look ahead. Let's look ahead maybe 3 years from now. We want to think in a post-pandemic world, whatever that means, or whatever, the world will look like in 3 years' time. But I think as a result, of everything we're discussing, what do we think? What will our workforce expect in terms of support, well-being, and, as a day-to-day matter rather than an exceptional matter from all of you employing them or from the system? What do we think well-being will look like in 2 or 3 years' time as a result of the pandemic as well? I don't know if Martin, perhaps you want to go, you want to share your view on it.
Yeah, thanks very much. And I think one of the things that will happen is people who are coming into our workforce, people who are in our workforce now, are going to expect employers to be really explicit about putting the well-being agenda right at the heart of what they do. And that will also be one of the differentiators employers will be able to say makes them different from other people in the sector. So I think there'll have to be some clear and explicit approach to this. I think also it goes back to what everybody has talked about, which is about listening. So there will have to be explicit agreement that you're going to put well-being at the very centre. But for different people, that will mean different things. So I think what you have to do then is to go to the next level and talk to staff about what works for them, how you can support them effectively. And I think people will expect not only the organisation to have a view about well-being, but they'll also expect some really clear individual plans on well-being. I think they'll also perhaps want some access to external support as well, that opportunity to have time to reflect, and also probably an opportunity to have some engagement with those who are not so close to the front line as they are, so that they can start to have an opportunity to bounce things off people. I think that's a really important element that people look for. I think there'll also be a lot more internal support. So, for example, organisations developing mentoring, buddying programs, having people giving people an opportunity to talk to their colleagues. It might be within the same service. In larger organisations, it might be between the different services they provide. I hope also that we will see in the future much more integration around the support for workforce across the whole system. So, for example, I want to see some of the things that are available to NHS colleagues being rolled across to social care colleagues. And with the advent of ICSs, there is no reason why they shouldn't have really clear workforce development, training and well-being plans that apply to everybody who's in health and social care. So I think, people who are working in our sector will start to expect that. I think they'll also start to expect a range of technological supports that will enable them to draw down advice, information, help whenever they need it in a really clear and very fast way. So I think there'll have to be some technological ways in which people can get support as well. So I hope that if we look forward 3 years, we'll see the pandemic has first of all transformed our understanding of just how brilliant our staff are. And I know that all of the people who are on this, on this seminar know that. But what we've got to do is we've got to make that everybody's business so they understand and value their workforce. That they really show the commitment the workforce shows to the sector being reciprocated by a commitment that government and employers show back to those people who are the absolute backbone of what we do. And without our skilled, able and competent workforce, we couldn't deliver any of the things that we do deliver. There are some big things that the NHS needs to understand about the interdependence between health and social care. And so some of the staffing issues need to be looked at in that way. And my final point about that is I'm frankly sick of the way in which everybody talks endlessly about integration, but they do not show that in some of the responses to, for example, our workforce challenge. So we know that there is a critical shortage of nurses, and the government has given £3,000 per nurse to NHS trusts if they recruit from overseas. They haven't transferred that into our sector either. So they need to look at some of those things. We had yesterday the Secretary of State talking about his 15-year workforce plan for the NHS, which is somewhere in his back pocket, and he's going to pull out like a rabbit come January. Well, I think he should have a 15-year integrated workforce plan. And the other thing to say is, if we are going to meet the challenges of the future, we can no longer afford to see our workforce in silos. We have got to enable people to move across systems just as citizens move across systems. And so I hope that the plan for the workforce 3 years hence will be about an integrated approach that values everybody's contribution, that enables people to draw down the support they need to thrive in their role, and then to establish that we are an absolutely essential profession that delivers for society. And there'll be so myriad of benefits that society gets from the work that everybody in social care does. So that's my dream for the future. And of course, Amanda, you're so right. One thing's a dream, and then now it's about the route map to delivery, I think.
Yeah. Can I respond a little to that? Can I respond?
Yeah, of course.
If I may. Martin, thank you. I couldn't disagree with anything you said at all. From everything that we see, certainly what I read every day, which is both NHS and social care, the NHS is struggling, understandably, to provide the level of services that it wants to and it needs to. If there was a closer working relationship and a pathway of care that everybody bought into across the sectors, then one would help the other. You know, social care can really help relieve the pressures of the NHS, providing we've got those pathways in place and there is a respect on those pathways. So I think there's a lot of work to do there on that sort of integration, and that has to be through really strong conversations and respect. The other thing that I just wanted to say is that, everything doesn't cost money. We're talking about investing, and everything doesn't cost money. If we listen, we hear, we engage, and the leadership that is in both sectors really engages, then that gives the right support to staff. I very much focus on humility and humanity. And recognizing that people have limits. Some people have a suite of skills. Not everybody has every skill. And likewise with myself, I know where my skills begin and end. And I know that who's got the skills I haven't got, so we can draw on them. But it's about listening. And one of the things I just wanted to say briefly is over the last 2 years through the pandemic as a coach, as an executive coach, staff that I've been talking to and coaching both within the NHS and social care have really struggled with the fact that people have not been listening. And that's what I've heard a lot through my coaching, because obviously my coaching relationship is confidential. So I can't go away and say to somebody, oh, by the way, you're not listening. But I was very struck by the number of staff that used me as an opportunity to download because they couldn't do it anywhere else. So these things don't cost money. This is about leadership. This is about really strong, open, transparent leadership.
Well, Irene, if I may just very briefly, very, very interesting point. We did a survey a few months ago with Martin and his team with Care England about staff support and well-being. And, in terms of what proves effective, listening to concerns and challenges to make staff feel heard, 91% of respondents said that was one of the most effective things that you can do. And that was followed, 71% of respondents, by offering staff support and well-being programs. We were talking before, investing in the pandemic. That costs a bit of money. Listening doesn't cost much. And these were the two top answers, in terms of what works and what doesn't. Far more effective than other things like offering time off, for example, which was further down the list. So I think just reinforcing what you were just saying there. But we've got a few questions coming in which are quite interesting. But before we do that, Raina and Amanda, as leaders of very large and successful care organizations, how do you think about staff support and well-being of the future for your teams? Raina, I don't know if you want to go first.
Yeah, I think Martin covered all the key points. I think it's interesting, because you can kind of look at it on micro level in terms of social care, where you can say, well, actually, globally, we're facing a whole different attitude towards work, and the pandemic has shifted that. And there was a great article the other day in the New York Times, I don't know if anyone saw it, about how people are frightened of 23-year-olds now because their approach to work and, you know, hierarchy and everything like that is just completely different. So I think we've got that kind of global, how are people approaching work? And I think for social, and then we've got the kind of national current issues, and then we've got what is social care offering. I think in one way social care can offer some of those values and those drivers for work-life aspiration that are coming through in those younger generations really fits well with social care, high value base, you know, quality, diversity, giving something back to community, all of those things really strong for the sector, and I think we can really attract. I think it goes back to, you know, there's some of the flexibility attitudes. I don't want to work a 40-hour week. I want to, you know, have several jobs. And yeah, in some roles in social care can fit that. I think the worrying thing is how do we attract those people? And I have no doubt that all those things Martin covered, we do absolutely. I think we're working on all of those things now, and they will just have to be strengthened and strengthened over the years. And, you know, as Irene said, there is so much we can do for free. It's not about the funding in a way by us so much. It is about that perception, funding, structure, the way that social care is arranged and delivered as a system as well. I think, does that give job satisfaction? Does that allow people to feel that the aspirations of social care are really being displayed in their daily work? So I think, yeah, we're absolutely, our whole people program is constantly under review, everything from learning development, from reward recognition, what can we do, that listening, that, you know, everyone wants to be heard, don't they? How much is the difference, whether you're someone using a service, whether you're a family member, whether you're an employee, feeling heard and seen and recognised, and some, you know, all of those little things day to day are, you know, can make a huge difference. And I think for us as employers, it's keep doing more of those things around wellbeing and making sure we are listening, we are engaging, honesty and openness. I try and always be honest with our teams. This is what I can affect change in. This is what we can affect change in. These things are really hard. I can't change that. But what we are doing is trying to link in with people like Care England or Home Care Association to affect change. And we're not going to shut up about it because we believe you're worth that voice. But, you know, so I think more and more strongly, but I do think that the general approach to work, I mean, I'm going to talk about some of the age issues. I was on something the other day and they were saying the average applicant now into the NHS nurse is 40. So we're almost not even attracting that younger, and then people are leaving earlier, they're retiring earlier because of I suppose, the current landscape and how challenging it is. So it's how do we attract each generation, and then how do we retain them and really look after them?
How do we prefer to support them in the way they expect to be supported? Because
exactly.
23-year-olds are very different.
Yeah. And I think it's not even a 3-year, it's something we're just going to be constantly reviewing and adapting to and evolving, because if you wait, you know, if you do it every 5 years, you're going to be missing out. So change and expectation is so fast now, we have to keep up with that.
I'd 100% endorse that, Raina, because when Martin was referring to the 15-year plan that people are talking about, in all the years that I've worked in the NHS, even 10-year plans don't work out. They get changed every 5 years. So whatever we do now, and I'm talking about we collectively, NHS and social care in terms of staffing or well-being, it needs to be, there's no quick fix. If there was, we'd have done it. But it needs to be a 3 to 5 year plan, and as you say, constantly evolving and being reviewed. Let's not sort of put our nail in the coffin straight away and say we're going to have a 10 to 15 year plan, because it won't happen. It becomes unrealistic.
Absolutely. No, that makes perfect sense. Now, questions from, well, there's a lot of acknowledgement in the chat for, you know, everything that the panel has shared today. And thank you very much for that. We'll just talk about next steps in a minute. But just one interesting question has come through. Is there a role from Tash, you know, is there a role for the public to play in all this that we're talking about? And what would that be?
I think there certainly is, and they've demonstrated that by playing it. First of all, we missed the public in our visitors, our relatives when they weren't visiting, and I think it really represented to us the psychological, emotional, and often, and at times, physical well-being of our residents. That shouldn't be underestimated. Has always been an integral part of what we do within social care in so many ways. And was heartbreaking at points where we had to funnel that or change that because of the very particular risks. But there are, and the care associate role that we put in to try and build ourselves a reserve cavalry at the height of the pandemic, the response to that was fabulous. With people just stepping forward saying, "Never done this before, I want to help." So while the nuances of that and how that is engineered and designed are yet to be developed, that role in itself made it clear to me that there are a diversity of people out there that once they began to understand social care were drawn towards us. What we need to capture is how to continue that stream and that pull towards us. And to do that, wouldn't it be great to have a really clearly designed, universal career pathway for people that came along?
Very, very interesting ambition to have, which I think is shared by a lot of our attendees today, and is shared by, I can see in some of the questions that we received before the webinar, certainly very much going in that direction. Another slightly different angle, which we haven't touched upon, before we wrap up in a couple of minutes, how do we equip non-traditional carers for a career in the sector? Because that's something else that the pandemic has brought, isn't it? More people, at least for a period of time, to the sector, but how do we equip them to stay in the sector?
Well, it's my view that what we have to do is do all the things we've talked about in this seminar, about valuing them, about communicating with them, about identifying what they do well, and trying to also unpick why they wanted to come into the sector if they're not coming from the usual routes, because that would be really helpful to us as a sector to know what made it attractive to them. I think Amanda's point is really interesting as well, the way you developed that army of people who are there to support you. And I think one of the things that we should try and do, exactly as you did, which is interest people who might not be the usual suspects, who might then turn to care as a profession. And I think there are lots of people as well who may have had caring responsibilities in the past and no longer have those responsibilities, but have so much respect for care generally and want to then make it a profession. And I think we should think about how we target some of those people, because they will have so much to bring to our sector through their own personal experience. So I think we've just got to be as open as possible to different routes into the sector. But then, as Amanda said, we have got to, and Raina says as well, we have got to then have a really clear career pathway so that people know that they're not getting a job, but they're starting a career. And also, I appreciate what people have said about the need to attract younger people, but I also think there's a need to attract people at different points in their life. And in fact, we're all working at the moment on a Care Now initiative, which is about saying people who might be at a particular point in their career, there's some great careers to be had if you move across to social care and you can use your skills, and they're eminently transferable, and particularly with the way in which the economy is realigning in relation to retail particularly, but also hospitality. There's some great people who could make a contribution in our sector. So I think what we've got to do is be as open as possible to everybody who could make a contribution, and then nurture them and give them a real clear understanding. This is a great place to develop your career and you can make a real difference.
Right.
Absolutely. Looking after them as looking after everyone, which has been clearly the theme for the conversation this morning. I mean, the acknowledgement in the chat to everything that we have shared as a panel, and just thank you very much. I just we always like to have longer conversations, but an hour is probably about right. So perhaps it's the time to, well, first of all, to acknowledge the panel. Thank you for making this happen, and thank you for everything you do every day. But it's a big thank you to everyone in attendance for what you do every day. As we said, there's people from health and care, there's really a very wide representation of health and care. And, it's a sincere thank you for everything everyone is doing every day. And we started on a positive note. We definitely want to wrap up on a positive note and think about what's coming next. Well, without being unnecessarily optimistic, especially where we approach the winter, or we're still in the middle of a pandemic, but maybe, just maybe, it feels that, together we can turn the pandemic in an opportunity to transform staff support and well-being, and make sure that in years to come, we'll look back as the pandemic as a turning point in terms of how our workforce in health and care is going to be supported, perhaps also as a result of that, and of what we've learned in the last 2 years. What we're going to do next? Well, we're going to write up the webinar, this very, very valuable conversation, and we're going to try to answer all the questions that we got before the webinar or after the webinar that couldn't be answered today. We're going to try to answer them in the write-up. But also, we'd like to develop the conversation on workforce support and well-being in the coming months. And what we're going to do next is, by the way, in the webinar, we're going to try to summarize actions we discussed today as well, because as much as possible, we like to be action-orientated. But in the coming months, we're going to have another one of these events between the end of January and beginning of February. We'll communicate that soon, just as the next step of this conversation to take forward some of the actions. And it will be a bridge to the Care England conference in March, where, of course, workforce and well-being, will be an absolutely prominent subject. We'd be delighted to hear any further thoughts from any of you who participated today. And again, a big thank you to be here. Please do so on social media, on our website, directly via email. Let us know about the event as well, what works well and what you'd like to see different in future events. We very much appreciate your feedback, as much as we appreciate everything everyone does every day. And maybe on that note, just a big thank you. Thank you everyone for being here today and making it such an enjoyable event. We'll see you at the next one. Thank you.